Yes. So you can prepare, and once you are ready, you can.
Yes, but how can I address you?
You can call me Jennifer.
Jennifer.
My name is Jennifer, and I'm 50 years old.
Okay, sure. Thank you. Now I am ready.
Yes, you can start.
Hello, Jennifer. How are you today? Please come and have a seat.
Thank you
Nice to
very
see you.
much, doctor.
You're welcome. Would you please tell me what is the reason you came here today?
Yeah, I am here because, I have recently been diagnosed with Parkinson's disease, and there is some sort of stiffness and movement difficulties. So I am little worried.
I understand your concern. What can I say about your medicine, L-Dopa, or like dopamine? It is a well-known medicine for Parkinson, and it has a potential to improve outcome and alleviate the symptom, and by this way it can improve quality of life. So I think it's very important to continue and take your medicine, start your medicine, and although it has some side effect, but don't worry, we can closely monitor you for the side effect. Does it make sense? Does it sound sense?
Yeah, of course. But the thing is, doctor, I do not like taking drugs. I'm not comfortable. I'm against taking medications.
I understand. Nobody likes to take medicine, but the thing is that between two options of having symptoms and taking medicine, I know that you will prefer taking medicine over having symptom. And this medicine, as I mentioned before, it can improve your the outcome of disease, and it can, although while it is not a treatment or cure for Parkinson, but it can slow down the progression of the disease. So, what do you think now after this explanation?
Okay. I want to know why you, doctor, think I need to persevere.
Sorry, I didn't get what you said. Why?
Why should I continue? Why should I continue with all these things? Is it compulsory?
I highly recommend to continue the medicine, and as you know that you were diagnosed as Parkinson disease. It is a degenerative disease, and it is progressive. So yes, I think it is compulsory to take medicine, although there are other ways of supplementary, or I can say complementary therapy for for Parkinson, but they are not a replacement for medication. What is
Yes.
your idea?
I want to know what exactly Parkinson's disease is. What are the causes of Parkinson's disease, and how does it affect my brain?
Well, I can say that Parkinson is the cause of Parkinson is I can say it is unknown and not fully understood, but there are some research or evidence shows that there are some factors or causes that might affect the start of this disease, like for example, genetic or environmental toxins or lifestyle. This is I can say the cause of this disease. And as I said before, it is a degenerative and progressive, and it affects the brain. And the reason for the symptoms is lack of dopamine. And the medicine which I prescribed for you is L-Dopa, and it increased dopamine in the brain. Does it make sense? Is it clear for you?
Yeah, of course, doctor. And I want to know if there is anything else that would help me manage my condition. For instance, exercise or any massage or something
Yes,
like acupuncture.
yes, I see. Yes, yes, of course. And there are some other alternative therapy for Parkinson disease, such as physiotherapy or physical therapy, that they can increase the mobility and facilitate movement, and also enhance improvement. Also, it helps you to initiate gait or reduce pain, and it helps you to breathe easily. Yes, of course, physiotherapy. If you want, I can recommend, I can refer you to a good physiotherapist.
Yeah, I am actually not ready to be convinced. I don't agree with these things, but what to do? I don't know. Tell me, doctor, why should I believe your words? I am
Regarding,
not interested to stay on the drug.
okay, understand. But you know, the main treatment for Parkinson is medication. Of course, there are some other alternative therapy, but they are not a replacement for medication, and medication is the main treatment. But if you worry about the side effect or other concern, we can closely monitor you in other sessions, and I am here to help you whenever you have any issue or any problem. But I can emphasize that the medication is the main treatment, and I highly recommend you to take the medicine. And but I am here to help you. Now, what is your opinion? Do you want to continue, or there is also another concern?
Yeah, because you are a doctor and I think you know it better, so I listen to you. Even though I am not ready for everything, it's better I listen to you, I think. So, okay, I'll do as you suggest.
Thank you so much for trusting me and for sharing the information. See you in another session. I give you another appointment, and we will see each other.
Yeah, thank you very much,
You're welcome.
doctor.
You're
Yes.
welcome.
Now, coming to the point, we are going to the feedback part. So, right. Yeah, Dr. Sholeh.
Mhm.
So, from Iran. This is
Yes,
Dr. Sholeh Toobei, a
yes.
doctor. She is from Iran and currently in Saudi, right?
No, Dubai,
Dubai.
Emirates.
Okay. Yes. Okay, fine. Right. So, Dubai, there are a lot of floods these days, I think. How is the situation? Is everything under control now?
Yes, yes, yes.
Right. That, thank God. All right. So, surely, now here is your feedback. Your quality is more matured. you have a lot of subject, you have the brief information which is logical and reasonable and which is more important, precise. You don't speak much, you don't speak less, you speak required amounts. But you are making the audience wait for your next words. I think it is slower than the slow mode. Maybe because you don't have too much practice when you are speaking. So you're not speaking in English too much. Maybe you're speaking in your mother tongue or some other language. So your language or the local language, you're speaking more and you're using less English. So that's why you're not used to speak English freely. So there is some sort of obstruction or a hindrance in the flow. The words are not flowing. They are just something cutting down in between sometimes. So you have to improve that area. Everything is fine. That's not a big problem. But still, if you improve your fluency, you will score even better. That's what I mean to say. So this is a pass mark, no doubt regarding that. You crossed 350. It may be 370 or 380 also. But you can even try for 400 plus and even up to 450. Because you can add quality. What all as it is now, that's 370 or 380. Because the subject is awesome. A clearly defined response. But there are some flaws. You're asking like this. What do you think after my explanation? What do you think after my explanation? You are telling everything and you're saying, what do you think after my explanation? Is this needed? Okay, what do you think after my explanation? So instead of that one, you can say, I think now you can consider taking the drugs on a regular basis. So what do you think means? He'll say, no, I don't accept. Then what you do? Even in the last, he's telling, I don't. He's adamant, reluctant. Even in the last, he's telling, I don't want to take drugs. There is no use of telling, what do you think here? Because he will definitely say, no, I don't think properly. I don't want. He's an adamant patient. He will tell the same thing again. So instead of that one, you can say, I have explained you the importance of taking medications or drugs. And therefore, it is necessary to realize the need of the hour and be compliant with the medications. Then you can say, how does that sound? Okay. So something like that you can alter. Then next again you asked, same like this one. What do you think like? Then you said, especially in the beginning, first minute, you had some problem to adjust because it was a first speaking session for you live. No problem. You're doing well. You have done well. No doubt you have done well. Lot better. There is no doubt. So these pauses and breaks are like unnecessary sounds. You can avoid. Normally, everyone does that. Even I do when I'm stuck. Even I do the same. So there is nothing wrong. There is nothing, that you are the only person doing like that. There is nothing like that. You're not singled out. Everyone does like that. Normally, 90% and 90% of people do this. Right. Then you said one sentence. It is compulsory to take medication. It is compulsory to take medications. It is compulsory to take medications. Why it is? Taking medications is compulsory or mandatory. Why you are bringing it unnecessarily here? Just say taking medications is compulsory or is beneficial or is mandatory. Just start with taking medications. So why you want to start with it? Because we have a habit. It is good to do that. Doing that is good. Why it is good to do that? Doing that is good. Why you want to start with it? Start with the subject itself directly. Na? So quality you can improve. And then, yeah, fine, everything is fine. A little more of practice, only practice. I don't find any weakness in you. Okay, simple things and only practice. More practice you do regularly, every day, one session, you can do practice. Yeah, Dr. Sholeh, you can unmute and you can start your video and you can share your experience now.
Thank you so much. I understand your point. I agree. I have to practice more, and this is very helpful. This session is very helpful for me. Thank you so much.
Yeah, you have done very nice, no doubt regarding that. Thank you once again. Okay, right. Yeah. Right. Next. Next candidate. So Kiran is over. Sholeh is over. Soumya. Soumya, are you there? Yes, Soumya.
Yes,
Yeah.
sir.
Elizabeth. Okay. If you want to take a speaking session, you can message me.
Yes, sir. I am ready, sir.
Okay. You are ready. I'll take the speaking session for you. No problem.
That carcinoma.
Yeah.
Skin.
Yeah. I'm coming. I'm coming. Squamous cell carcinoma. Yeah. This is the card.